Greetings, fellow traveler. This is State of Emergency Day 43. Time is flying by and we're still waiting. It's the 24th of April, it's a Friday, and I took my bike here to Astangu to just, get some fresh air and see what's what. It's a nice spring day, about 10 degrees or so. Not really that sunny, but people are still using it to spend some time outdoors, and you can understand that people are getting tired and bored of all of this. And I found myself between mood swings from being lightheartedly productive and then just depressingly dull. But I suppose we'll just have to try to keep our minds clear and make sure that we don't cloud our judgment. And today I'll be focusing on the exit strategy that the government has been working on. And yes, it's Friday, they were supposed to announce the next steps this week, and well, so far still no official announcement has been made. Presumably it's going to be announced later today whether they're going to extend the state of emergency or not. Different ministers have had different messages that they've been sharing with the public, but all in all it does look like they're going to extend it probably 2 weeks. The debate has been whether between 2 weeks or 1 month. But a lot of businesses, as well as just people, are eager to know what's going on, because the 1st of May, when this thing was supposed to end, it's already a week from now. And later on in the video I'll also be covering the question whether this is a flu or not, taking Iceland and the case numbers there as an example. But first of all, a short overview of some of the developments from the recent days. The mayor of Saaremaa municipality, Madis Kallas, will resign in May, taking the responsibility of Saaremaa, the biggest island in Estonia, being hit so badly by the coronavirus. It's the most severely affected county in Estonia, and even though the absolute numbers by now are again bigger in Harju County, then Saaremaa still has far the worst numbers if you take into account the population of the counties. Fortunately, there are also promising signs coming from Saaremaa, which shows that the worst for this time should be indeed behind us. There were also a number of public events, international public events, that took place at the beginning of March in Saaremaa, which might have played a role in the spread of the virus there. But the health board back then didn't give any straight guidelines that they should cancel those events, so the municipality went on and, now we're where we are. And that's why Madis Kallas is resigning to take the responsibility. There's also been some sharp debates about Tallink, the major ferry company, and LHV, one of the biggest banks here in Estonia. So LHV made a loan offer for Tallink to get them through these tough times. But the loan offer really seemed like they tried to take advantage of the whole crisis situation, and they were more or less pushing Tallink in the corner. So Tallink declined the loan offer, and I guess this disillusioned a lot of people who did feel, included that LHV, from the whole banking sector here, seems to be the lesser of all evils. It's a bank based on Estonian capital, not like most of the other larger banks that are all owned by Scandinavians. And quite a few of those Scandinavian banks have had quite serious money laundering scandals. As far as international travel is concerned, which is a subject important to a lot of people, then, for example, Air Baltic, the Latvian air company, will start operating flights in May. All in all, approximately 85% of total flights in Europe have been cancelled during the crisis. And you can really feel it every day, because the skies, they're not roaring anymore. And, maybe that's something we shouldn't be that sad about. I mean, maybe flying less in the future is something we should actually be aiming for. So maybe that's something to take away from all of this. Why not? And now about the restrictions here in Estonia and how long will the state of emergency last. Well, different members of the government have made it quite clear that everyone should be prepared for this whole thing to be extended. There are different opinions. For example, the neo-conservative EKRE would want more harsher restrictions to be still kept for a longer period of time, while, for example, the centrist Keskerakond would want to start easing the restrictions sooner. Now, all cabinet members have made it clear that, of course, they would want to end the restrictions as soon as possible, but also nobody really wants to take the risk of a new wave coming as far as the virus is concerned. So even, for example, if the state of emergency itself won't be extended for a very, long duration, then still people should take into account that the restrictions, well, they'll probably last a bit longer. And maybe not even a bit longer, maybe quite a lot longer. They're going to start easing some restrictions even during the state of emergency, probably. But for example, the 2+2 rule is something that we're going to have to get used to living with for probably quite a while. And probably public events is also not something that people should be counting on taking place in the first half of summer. But this is really not, that big news. We basically knew all of this already a week ago, so people are understandably, even more impatient than before that, come on, what's going to happen, how are we going to carry on with this. The restrictions that will probably be in place for a longer period of time will, of course, then affect, for example, international events. And by now, as sad as it is, Pink Pop has been cancelled. I was supposed to head there myself in June, share some vibes with Mr. John Frusciante, who has now rejoined Red Hot Chili Peppers. But I guess I'll just have to wait for another time. And a lot of other people as well. But that's just the reality. And it's all for actually the greater good. Let's not forget that. Well, officially Pink Pop isn't cancelled, it's postponed until 2021. If you bought the ticket, then you can still use it next year. But postponed, cancelled, well, it's not going to take place this year. So that's that. And that's also the case, for example, with Positivus Festival, a big music festival that's organized in Latvia mid-July, 17th and 18th of July. And that's a sign that I guess a lot of Estonians also are being cautious about, because late July there is the Viljandi Folk Festival, which is one of the biggest music festivals here. And in early August there's also the Intsikurmu Festival, which also usually brings quite a crowd. So I guess this is not the time that people are jumping to buy tickets, but so far there also hasn't been any public announcement that either one of those two festivals here in Estonia will not take place. And I mean, after all, there are already international events that were supposed to take place in autumn that have been cancelled. Probably the Oktoberfest in Germany is the most well-known example. So yeah, all in all, we're still just waiting. How will the next steps affect travel restrictions, and how will this affect the shopping centers? Also, how will this affect museums? Are smaller events, maybe up to 50 or 100 people, allowed in the near future? But all in all, I mean, as far as the outbreak goes, things are moving in a hopeful direction. And if you look at the recent numbers here in Estonia, then the trends have been favorable. And one of the big aspects to pay attention to is the number of hospitalized patients. That at the moment stands at 103, which is about a 34% drop from the high of 157 on April the 12th. The total numbers here in Estonia, as I'm recording this, stand at 1,605 confirmed total cases and 46 total deaths. So is this just another flu? I mean, this has been going on for quite a while now. I'm somewhat surprised that these questions are still being asked, but it's also understandable because, this has affected the livelihoods of a lot of people. And, there's a lot of people who feel that since the end of times haven't arrived, that maybe this was all an overreaction. Well, if you compare the SARS-CoV-2 with the typical flu, then, for example, here in Estonia this season, the flu has taken the lives of 12 people. And well, SARS-CoV-2 has so far, only with being here for 2 months, since the first case was reported on the 26th of February, has taken almost 4 times the same amount. Now, it's been a modest season as far as the flu is concerned, also because the restrictions applied because of the COVID-19 outbreak have obviously also helped to hold back the spread of the regular flu. But even if you look at these preliminary numbers, then it's apparent that this is a lot more dangerous than the flu. And the cure cannot be worse than the disease. Makes sense. But also we still don't have the full picture, the numbers are still growing, we haven't hit the final end point, and that's why it's really easy to get disorientated. Yes, COVID-19 has a fairly low mortality rate, and that's something that we should, actually be glad of. But it's not like this thing was announced as the Armageddon. It doesn't have to kill the population of the whole planet to severely affect our societies and, our just healthcare systems. Because if it spreads really fast, even the Western countries don't have enough hospital beds to take in all the patients. And, that's largely the reason why these restrictions were applied, to win some time in this battle against the virus. I mean, countries don't shut themselves down without any reason. Everyone would actually prefer if life would go on the old way, because, we could keep the economy running the normal way, there would be profits, and there would be money, and, that's something that our economical systems and our countries generally strive for. Also, don't forget that it's not like, this has shifted the place with the flu or any other disease. It's still all the old buggers plus this thing. So COVID-19 is like the new kid on the block. We still have to get to know him better, have to get to know his customs, his way of life, to see how we can live together with him. So yes, these are tough times, but clinging on to simplified explanations really won't do good to any of us. And, it takes time to know this virus better, because good science takes time. Science is not just, and that's it. So Iceland, for example, is a good country to look to if we want to maybe get a clearer overview of, how deadly and how contagious this thing really is. They're a small country with a population of around 360,000, but they've done more than 45,000 tests by today, which makes it about 12% of the whole population, and that's far more than any other country in the whole world. And the more it test, the clearer picture we actually have of the disease. So far, Iceland has had a total of 1,789 confirmed cases, out of which 10 have ended with the patient dying. So this would put the case fatality rate at around 0.56%. Now keep in mind that there is no fixed universal number as far as the mortality rate goes, because it also depends on the health of the population as well as the healthcare system. And Vikings seem to be like nature's crown. So, all in all, what this means is that countries with a high fatality rate, if you take, for example, Italy or Spain or even the UK, then the actual spread is probably a lot higher than the confirmed numbers. And this is something that we've known the whole time, but it's really hard to get the actual picture if, there isn't enough testing being done. I mean, okay, COVID-19 isn't that lethal, but at the same time, it's a lot more contagious than we've thought. And even if you take the 0.56% that Iceland has as the mortality rate as the base number, then keep in mind that the regular flu has a mortality rate less than 0.1%. So if you want to compare it to the regular flu, which leads up to around 650,000 respiratory deaths a year, then the bare minimum equivalent for COVID-19 would be then around 3.6 million. So if you've been just sitting home feeling that, what's the difference? Then, the difference is that we've saved the lives of at least 3 million people. So, that deserves a round of applause. But also keep in mind that this 3.6 million is definitely an underestimate, because unlike the flu, we have no immunity, and also this thing is more contagious than the flu. So if a regular flu can infect up to 1 billion people globally, then SARS-CoV-2 would have no problem passing that number if we would not do anything about it. And that's why we're here today, because still no vaccine has been developed and there is no proven treatment, emphasizing the proven part. I think today Donald Trump thought that injecting disinfectant might work for the lungs. So, don't start injecting yourself with stuff, because Donald Trump is not a doctor and he hasn't really done any scientific research on COVID-19. And of course, living with these restrictions cannot last forever. And we will have to find a way how to live with this virus. We will have to find a way how to make sure that the people most at risk are protected and their healthcare systems are prepared to battle the next wave. Because while things are looking hopeful, then we shouldn't fool ourselves that this will come to a quick end. We have to reorganize our habits and our customs to make sure that when the next wave comes, we will be more prepared, both as individuals and as societies. Because by now, I believe most of us are acknowledging the fact that, probably this thing is going to be around for a while. And as far as fear goes, well, I don't feel like I'm living in fear. I'm not afraid of the virus itself. If I would catch it, then probably I would be sick for a few days. It would be a bit uncomfortable, but likelihood it wouldn't really do that much damage to me. But I can carry the virus, and I can spread it to someone who is a lot more vulnerable. And that's why we should not forget that it's not only about me, myself, and I. Other people can get sick because of me. Other people who might be affected a lot more severely. Other people who might get hospitalized or even worse. And that, kids, is why social distancing matters. Who knows, maybe time will prove me wrong. I mean, people who are losing their jobs in Tallinn, for example, in hotel industries or catering, well, in all likelihood, they're not going to go to South Estonia to work on the fields. So yeah, I've been wrong before, and I wouldn't claim that it's never going to happen again. Maybe Sweden's approach in the long term will end up being the great example after all. I mean, I wouldn't bet my money on it, but, well, you never know. All in all, I'm, only human. Humans can make mistakes, but so can everyone else. And that's why you should be critical about the information that you're getting, and really wherever you're getting it from. Especially if someone claims to be the sole bearer of truth. That should make you especially careful. Because the truth is, life is a chaotic mess, and we're constantly trying to make sense of it. We're all trying to figure it out whichever way we can, but taking someone's prophecies as pure gold, well, you might just get your fingers burned. And you might end up burning a lot of other people's fingers as well, or lungs. We are, after all, an extremely peculiar species, and the fact how fast this virus has spread over the world shows how interconnected we have become by now. It hasn't always been like this. Just a couple of 100 years ago, this would have been quite a small, minor outbreak just in some small Chinese town. But that's not the world that we're living in anymore. So once in a while, it's good to take a step aside and try to look ourselves from a different perspective. One moment. Anyhow, I've been reading this book, which is Yuval Noah Harari's *Sapiens: A Brief History of Humankind*. It gives a pretty good overview of how we've come to this point as species. Well, it's a pop science book, so it's more like good storytelling with some curious facts. And besides history, it also asks the question that what is the direction that we're heading towards? So if time has been slow for you and you're curious about our whole species, then, this might be a good book for you, because it really does help to pass time. It goes fast. So that's it for today. If things remain like this, meaning more or less stable, then this shouldn't really last a lot longer than, well, a few more weeks. So let's see what the future brings, and take it easy.